Judy, can I have you give me your first and last name, please, and also that you authorize us to use this video testimonial for other doctors, instruction or on our website, please?
Judy Zing, and I grant you permission to do that.
Thank you, Judy. Okay, Judy, I just want to start by having you tell us a little bit about your neuropathy, how long you have been dealing with foot pain, and can you tell us how you were before you came to see Dr. Kukurin, and how long you've been dealing with this problem?
Well, it's been going on for several years, and my feet became sort of like, I used to call them stumps. Like I barely knew they were there. I could walk very short distances and stand for very short distances. It felt like if I stood any longer, I would just collapse. I had shooting electrical-like cramps going from my toes up to my groin and occurring mostly at night. Using massage and different creams and stuff like that, and medicines gave me some relief, but not much. I finally went to a scooter type thing. It was the only way I could get around and shop. So I sort of began to feel that this was going to be my life. Like I could ride a scooter here and there and get out and walk a short while. I had seen an article on Dr. Kukurin a year ago, and I thought, well, this sounds like something that would be helpful. So this year I decided to make the time to come, and I'm very glad I did. I think he's a very intelligent, caring individual, very knowledgeable about neuropathy and the related problems. He has helped me immensely. I now can walk better, stand straighter, and move. I'm not having the cramps and the pain. Of course, occasionally I revert back to one or the other for a very short time, but it's been only a short time, maybe close to a month, and I feel like we're on the right track, and he's helping me a great deal.
Judy, let me ask you, what was your pain scale before starting with us? On a scale from 0 to 10, where were you? And tell us where you are today. How different are you, from before you treated on your pain scale to where you are today?
It's a vast difference. When I would get the neuropathy cramps going up my legs, I was in tears. The pain was so bad, and there was a time or two when I wanted my husband to take me to the hospital. I imagined that I was a number 8 or 9, sometimes 10. Since treatment, I feel like I am down to maybe a 3. I have occasional flare-ups, but for the most part, I feel somewhat pain-free. I still have some issues with my feet and their feeling, but I think it's getting better every day.
Very good. Judy, a lot of people that know you notice a big difference, and even our staff here has noticed a big difference with walking. Do you notice a difference with walking?
It's strange because sometimes we forget just how bad the pain was and how bad we weren't able to walk. And you're right, and even my husband notices when we go places. He says, he can't believe sometimes how far now I can walk to get to the car, or that I'm walking straighter and better.
That is so exciting. What would you tell someone about the treatment you're receiving here? What type of treatment? And maybe someone may say, oh, Judy, it sounds too good to be true, how much better you are. What would you tell them about Dr. Kukurin and your treatment?
Well, I think he's amazing. He's such a gentle doctor that you hardly know he's treating you, but yet he's very intelligent, and I've told my friends that they need to try it because it does work. And I've even talked to my son at great length too, because I think it would be very beneficial to him. He's in a lot of pain from back issues, and I just would recommend the doctor and his staff. I even like coming to the office and everybody is nice and friendly and caring. That's one of the things I've noticed the most, that, you know, everybody speaks to you and is concerned about you and excited about what you're doing. And I think that of all the things I've done and where my health was just a few short months ago, it's actually amazing to me that I feel finally I am on the road and I'm doing what is good for me and what my body needs, and I'm going to be able to continue getting better.
Every day is a step in the right direction, right?
Absolutely.
Judy, is there anything different with your medications before treating and now treating? Have your doctors been able to decrease any medication that you were taking for your foot pain?
I've decreased the nerve medication immensely, and also along the way I'm decreasing my diabetic medicine, and even my blood pressure has reverted to a very good number, and I think my cardiologist is going to be amazed when I go back to visit him, because it is the lowest that's ever been.
Thank you, Judy. And I want to ask you one final question. It may sound a little silly, but I want to know your neuropathy treatment. Doc does a lot with you, some non-invasive nerve stimulation, some acupuncture, low-level laser, some adjusting techniques, sometimes the counter strain on your feet or reflexology, ultrasound. I want to ask you, with this smorgasbord of treatment, do you have a favorite part of the treatment?
Today I actually slept through the whole treatment. That's how relaxed I was. I think it's wonderful. I couldn't even know what I like the best. I think it's amazing that you can lay there and have acupuncture and laser and stimulation, and I think it's all been helpful. I've never found any of my doctors or anybody else that has provided any relief for me as far as getting better. And that's the most important part to me. You can cover up a lot of things with pain pills and medication, but when you can't walk, you realize that there are things that can be done and things that will make you better. I'm grateful, and I'm only hoping that I keep improving along the way.
Nice interview, Judy. Thank you.
So I'm feeling better every day, almost in every way, so I'm really sort of excited about it.
Judy, do you want to mention anything about Ideal Protein?
When I first saw Ideal Protein in the little aluminum sacks, I thought, oh no, is this Nutrisystem? I was very pleasantly surprised about Ideal Protein. It tastes good, it's easy to use, and it works. And the other nice thing about it is it's just right there. You follow your little schedule and you eat what you're supposed to eat. You don't eat what you're not supposed to eat. But there's enough variety in Ideal Protein that gives you your sweetness and your saltiness and all that kind of stuff. And you do get to have your fresh salads and fresh vegetables in your protein once a meal. And I think it's pretty amazing. I've tried many, many diets over the years, and this one does work and it is doable.
And last but not least, Judy, why did you decide to start Ideal Protein?
Well, I'm going to be 72, and I just got sort of tired of thinking, is this the rest of my life? I've been heavy for several years now, and it really inhibits your activity and your fun. So I thought, I'm going to try this because it sounds like it's going to work. And it is working, and I think it's very good. And I think that I have recommended it to several people. And hopefully some of them will take it and find out that it's a good thing to do.
Judy, before we wrap up your interview, is there anything you'd like to mention about your treatment, about your care, how you're improving? Did I miss anything?
I don't think so, Lori. It's just been very, very, very nice. And my treatment at this office is ending this week. And I'm very sorry about that because I'm moving back to Ohio. But I'm sure I will run into this staff again in Pittsburgh. And I'm very anxious to continue the diet. I've had a few other health problems along the way that has some days hard to stay on the diet, only because I I'm going back to Ohio, like I said, and all my friends are inviting me to dinner, and it's very nice, but you have to be, you have to sort of pull your friends in and say, hey, I'm doing this and I really want to do it and I need your help to make sure that I don't eat the wrong foods. So, and everybody is really good about it. I've been staying with my son and daughter-in-law, and they're real excited, and they make sure I have my drinks and I eat my meals like I'm supposed to. And I think it's wonderful. And like I said, I think the staff is excellent. I enjoy coming here.